So welcome to the Coach App Instagram Live. My name is Dr. Gary Shlifer. I'm a co-creator of the Coach App. I'm an internal medicine specialist, and I really have focused a lot of my practice on men's health. I'm lucky enough to help drive the nutrition track for the Coach App, and over the next few months, I'll be helping kind of improve and optimize that part of the program. Today we have a special guest, Dr. Justin Houman. He is a urologist and a specialist in men's testosterone levels and men's overall sexual function. We're going to talk today about the testosterone pandemic. It's an interesting subject, and many of you may not be aware, but really the testosterone levels in men is plummeting, and it is a multifactorial issue. There's a lot of reasons why this is going on. We're going to talk about why it's going on. We're going to talk about what you should be looking out for to make sure that's not going on with you. And we're going to ultimately create an action plan, things that you guys can do to improve your health. We're really excited to start this series of Instagram Lives. We're going to be talking about many topics in the men's health space. But we really think it's important to focus on testosterone and things that you may not know. And it's obviously something a lot of people worry about. A little bit about myself while we wait for Justin to join. I'm an internist, and I have a practice here in Los Angeles, California. Initially my practice was a general primary care practice, but I've over the last half a decade, I've started to focus on lifestyle medicine. Lifestyle medicine really focuses on things you can do outside of the pharmaceutical space to really improve your health. I focus a lot on nutrition. I talk a lot about sleep. What? Oh, we're trying to get Justin in here. There he is.
Hey, how you doing?
Justin, nice to see you, man. How are you?
Likewise. How's it going?
Great. Just getting this started. It's fun. All right, is it right? You're in Los Angeles?
Yeah. You too, huh? I just heard that you're from here too, or you practice out here.
Yeah, I practice out here in Woodland Hills. I grew up in the Valley. Went to UCLA. I'm an LA guy, and yeah, I love being here.
Yeah, so my office is in like the West Hollywood, Beverly Hills area. But yeah, I went to UCLA as well, actually, for undergrad.
Cool. Well, we should probably jump into this. I think we got some folks on. Do you want to kind of I gave a little intro. Do you want to kind of let people know about yourself so they know who they're talking to?
Yeah, so my name is Justin Houman. I'm a urologist and a men's health specialist. So a lot of what I do is I deal with men's health issues, the most common ones being sexual and reproductive health, which a lot of that includes testosterone management, ways in which we could naturally boost testosterone, as well as ways in which we could do it through various forms of replacement therapy. So, that's what we're going to talk about today.
Absolutely. I think, to just dive in, the first question is, what is the testosterone pandemic? I do like that, the term. I've certainly noticed it in my practice. Can you tell us what that is?
Well, I mean, we're noticing that men, it's one of these things that we're learning more and more about it. There's a little bit more research going into it over the last few decades, but really, typically at the age of 30, our testosterone levels are declining by about 1 to 2% every year. And for some guys, and that's on average, so some guys it's less than that, some guys it's more than that. But and some men they'll notice an impact, or they'll notice the effect of that, whereas others won't necessarily notice that impact. So it's one of those things that's relative to who you are, your biology, how it impacts your lifestyle. But it is a pandemic in the sense that it's something definitely decrease the quality of your quality of life, your energy levels, your sexual function, your work performance, everything across the board. It could have negative impacts.
Yeah, and it should also be noted that really this is something that's happening over time. I mean, there's a bunch of studies looking at testosterone levels in men, even just 2 decades ago, and the average testosterone level is plummeting across the board. Even, just 20 years ago, the average 60-year-old had much higher testosterone levels than they do now. What do you think's going on there?
Yeah, a couple things. It's tough to say it's just one thing, but what
Exactly.
we do know, one big thing is the effect of the impact of sleep on testosterone levels. And I think sleep, and this is something, we could have a whole different discussion about this, but sleep is a problem for many guys, many men and women right now. Sleep in general, and as the years go on, they get worse and worse in terms of we're being constantly being stimulated throughout the day. We're getting blue light from our cell phones, TV screens. Um, just the anxiety, the pressures of the day are impacting our sleep, and they've done studies on this, looking at how sleep impacts testosterone levels. And they actually, it was pretty interesting. They did something, I think it was in Cleveland, where they looked at the testosterone levels of medical residents, right? Just the doctors in the hospital versus everybody else. And they age matched them. So, a 30-year-old hospital employee versus a 30-year-old resident. And they found that the residents, their testosterone levels were about 150 to 200 points lower than that of the regular, the other hospital staff. And a big part of that is the sleep, the lack of sleep. So not getting good sleep, not getting at least 7, hopefully 8 hours of sleep a night, could really impact your testosterone levels. So that's one thing. And the other things you have to think of is nutrition, the diet, the food that we're eating, processed foods. These aren't good. They're not good for overall health. They're not good for our testosterone levels. And then something should be said about the fact that cell phones, guys holding cell phones in their pockets in close proximity to the testicles, we do know that it affects fertility. At the same time, it has to have some impact on your testosterone levels. So these are all things to be mindful of.
Yeah, absolutely. I think it's definitely what we call in medicine like a multifactorial problem. It's
Right.
many different layers of things that's contributing to this. Essentially, what it is, it's a hormone imbalance, right? So all the things you're mentioning, they alter your hormone levels. I focus on nutrition, and when you're eating poorly, it changes your insulin levels, your ghrelin, your leptin. There's a whole plethora of hormones that are directly affected by what you're eating. And then the downstream effects are changes in your testosterone. And people don't think about those connections. And I think that the sleep, the nutrition, and we should also mention like the movement, like physical activity. People are just too sedentary these days.
Yeah. Yeah, exactly. The sedentary lifestyle. That's a great point as well. Yeah, precisely.
So tell me, so we know that there's a huge pandemic. It's really out there. People are struggling. What should people be looking out for? Like, why is this interesting to everyone? What are the symptoms? What are the things that people? I mean, obviously, people think about erectile dysfunction issues, but tell us about that and kind of some of the other things that you see with guys that have low testosterone.
Yeah, the main concern that usually brings guys into a clinic when they're talking about low testosterone is sexual dysfunction, right? By that I mean either loss of libido, or like that sex drive isn't there what it used to be. And I'm talking about, like, it's not a gradual fall. It's, they'll feel like a year ago they had that drive, they had that motivation to engage in intercourse, and now it's not even present. Or erectile dysfunction. Those are the ones that usually bring guys in. But if you think about the symptoms of low testosterone, I mean, they're wide ranging. So low energy levels, chronic fatigue, mood issues, like you're irritable, you get upset a little bit more often than you typically would. You're not as mentally stable, is a way of saying it. Poor sleep, feeling depressed, not exercising the same way you used to. If you feel like, previously you would go to the gym for an hour or 90 minutes without any problems, now you're going in there for 20, 30 minutes and you're exhausted. That's another sign of low testosterone. And then, like I said, the sexual dysfunction. Now, do you have to have all of these in order to be diagnosed with low T? No. Really, it's if you have, I mean, we could talk about this too, but the diagnosis, really, it's a blood test and symptoms. And you really want to assess both. You don't necessarily always want to treat the number, but more importantly, want to treat the symptoms. So if your testosterone levels are a little bit low and you do have symptoms, that's when you could treat your low T.
I mean, it's probably a little too nuanced, but tell us like what is you're making these diagnoses every day. What do you use? What are your guidelines or what are you? Yeah.
Great question. Great question. So It's twofold. So it's a blood test, like I said, blood test and then symptoms. So when you think about that, it's the range when we say on the blood test, the normal range for testosterone is anywhere from 350 to 1,000. Now that's broad, right? That's a broad range, and it's a little unfair to say that's the normal range because what I need for my testosterone requirement is different than yours, and it's different compared to, I don't know, let's say a basketball player or a football player. So maybe I need 400 in order to feel good. Another person may need 550, right? So the number gives us some sense, but the symptoms, that's why you, like I said, you need the symptoms. So looking at those two together, numbers and symptoms, then we can make a decision on, all right, well, yeah, you are experiencing chronic, or you are experiencing fatigue. You are experiencing, like you come home from work, you want to take a nap. You are experiencing sexual dysfunction and you have a testosterone that's a low end of normal. That's when we can engage in the discussion of, hey, listen, there's something here going on that we could, you're experiencing low testosterone symptoms, and then we could talk about ways in which we could boost that.
Yeah, and before we jump into that, I really think it's just a question that comes up in my clinic so much. People will come to me worried about low T, and they're talking to me about, hey, I'm worried that my free testosterone is this, or my total testosterone is this, and I'm worried that my estradiol is high, or something like that. What are the markers that you're really looking for, just to kind of give people an idea of what we're going to be testing when they come in?
Yeah, so the blood test, it's not just the testosterone level, right? It's not just the total testosterone that we're checking. We're checking a few things. That they just to give you, a simple sense of how testosterone is made in the body. We have a gland in our brain, the pituitary gland. It secretes a hormone that stimulates the testicle to produce more testosterone. So we assess the level of that hormone. It's called luteinizing hormone, LH. We check your total testosterone value. Ideally, you want a morning number. That's ideal. However, people get non-morning numbers, which is okay as well. But ideally, we want a morning number. And then we check your estrogen levels. We call it estradiol. So every guy needs some estradiol in their blood, in their bodies for good bone health, good cholesterol maintenance, and then also for sexual performance. It's an important part of libido. So we assess all of those, and there's different ways, and everyone has different numbers. But looking at those numbers, it gives us a complete picture of what's causing your testosterone symptoms or your low testosterone number, what's causing that, and then ways in which we could address it going forward.
So I love it. I mean, so I think people really need to understand going into the doctors that it is kind of a dynamic diagnosis. Like, it's not just one number that we're looking at, and it's the clinical picture. And, going back to the symptoms, there's also this pattern I see, and tell me, maybe I'm wrong, but, I see these guys, they're slouched over. They can't keep muscle mass on them. They're not necessarily super heavy, but they have the gut, and the abdominal obesity really comes from insulin resistance. They're not exercising. They're not sexually active. They're not doing anything that, a man for, hundreds of thousands of years while we were evolving has done to be a man. And I think that so much of that is just this disconnect, our lifestyle disconnecting from our ancestry. Do you think about things in that context as a urologist?
That's a great point. Absolutely. So like what you were saying, inactivity, right? A big part of that is that inactivity, not getting out in the sunlight, right? Like vitamin D is a big part of testosterone. Like, when people are taking testosterone boosters, the supplements, vitamin D is a big part of that. So yeah, getting at, like you said, things that have made us who we are, for generations, for centuries. So getting out, being active, not living a sedentary lifestyle, waking up, going in your car, going to work, sitting down all day, going back to, coming home. These types of things, they're not good for good testosterone maintenance. So it's exercising, socializing, getting sun. All of these things are very, very important.
Yeah, and also, I don't want to forget to mention it. Also, the use of pharmaceutical drugs. If I'm not mistaken, like a huge proportion of the folks that, at least in the states that we diagnose as low T, they've had chronic opioid use, chronic like benzodiazepine use, or some other substance abuse. Is that right?
Yes. Great point. So I've seen a few patients, who have chronic back pain, so they're on opioids. You check their testosterone levels, they're in like the low 100s, and they're saying, "Look, I'm so tired, I'm chronically fatigued." You boost up their testosterone levels. Obviously, you talk to them, you figure out how you could address it. But once you do, they feel a lot better. So this, and again, we could have a whole different discussion about the negative impact of opioids, but it has a huge impact on normal testosterone maintenance. Absolutely.
Yeah, I'm trying to touch on all these different things. I feel like so many people are just focused on, oh, like sexual dysfunction, but there's so many factors that contribute to this, and people present in so many different ways. I'll also add, like, when in clinic, I'll have folks that are, they change their diet, they're eating, I promote a low carbohydrate diet. I really try to get people to do intermittent fasting strategies with it, which I think is essential to improve your overall hormone balance. And they'll get stuck, and that's sort of what prompts me to start looking at their hormones. And at least in my approach, it's always lifestyle first, and if we get stuck with lifestyle, then I start thinking about either replacement or some kind of supplementation. I don't know, just wanted to share, just because
That's great. That's
there's
probably
so.
the doing it,
Go
to
ahead.
be honest.
Go ahead.
I said that's probably the best way of doing it, to be honest. That's great. That's great. You allow them to really supplement or at least boost it up themselves naturally.
Something that is really interesting that I want to bring up, it's how does the lifestyle on a kind of hormonal level, how does lifestyle behaviors hinder the testosterone production? We kind of mentioned estradiol, but can you talk a little bit about that? Like, what are the mechanisms, or, things like inflammation and just conversion of test to estradiol? Can you kind of go into that a bit?
Yeah. So that's a good. So what testosterone in the body does one of three things. Either stays as testosterone, it gets converted to a hormone called DHT, and that's responsible for male pattern baldness, and then also prostate enlargement, like natural or benign prostate growth. So it gets converted to DHT, stays as testosterone, or it gets converted to estradiol, and that's the number that's the word we were talking about earlier, the estrogen. Now, is it okay to have some in your body? Absolutely, that's fine. But some guys, due to various issues, being inflammation being a big part of it, poor lifestyle, being heavier, having more fat on your body, you're converting, we call it aromatizing. You're converting more of your testosterone to estrogen. So as a result of that, your testosterone estrogen balance is off. So typically we want at least a 10-to-1 ratio between your testosterone and estrogen. Now, when your estrogen levels go up, your testosterone levels may be normal. Let's say your testosterone levels are 500. But if your estrogen levels are an 80, 90, or 100, you're not at that 10-to-1 ratio. So we have to fix that. So you're not going to feel the benefits of high testosterone or normal testosterone because your estrogen's competing against it. So that's something we have to be mindful of. But yeah, the things that drive that, like you said, poor health, poor overall health, inflammation, and not being really active.
Yeah. So just, again, it's just so many factors, but this inflammation is driven by nutrition, poor nutrition habits, lack of exercise, and poor sleep. I also think it's important to mention, if you're not sexually active or if you're not focusing on your mental health. Mental health is such a big issue these days. Can you talk a little bit about how, that might correlate with testosterone issues?
Yeah, so kind of like what we touched on earlier in terms of mental health. I'll tell you in the form, it's guys. So some guys actually, they come in, they're like, the reason I'm here is because I feel like I have low testosterone. You ask them what their symptoms are, and they're like, look, I feel anxious. I feel very irritable. I feel like I'm depressed. I don't feel good. So the question is, chicken or the egg? Is it the testosterone causing the mental health issues, or vice versa? So either way, we do know that if you do have low testosterone, you could have some, like those things, like anxiety, depression, or depressive symptoms at least. And vice versa. Some of the medications associated with that could cause low testosterone. But yeah, ultimately, you do need a good evaluation to see where the cause of this is, or what the cause of it is, in order to determine how to best treat it.
Yeah, absolutely. And really all of the things we just talked about are sort of a chicken or the egg. You mentioned, like, if your poor sleep could drive low testosterone, but then having low T can cause poor sleep. If you don't exercise, it can drive low testosterone, but then if you have low T, it's hard to work out. They're all together, which is why it's so important to think about it as lifestyle medicine. Like, all components of your lifestyle need to be addressed. And if you're missing one of these, or if you're doing well in a couple of them, but you're really doing bad with sleep, for example, you know, there's the old saying, you know, I'll sleep when I'm dead. That
Right.
needs to be on. Like anyone that's practicing medicine these days or that's focused on health knows that, you know, there's book after book and research study after research study talking about how important sleep is. When it comes to nutrition, I think the truth is coming out that, you know, the food companies and a lot of the marketing is about making money. It's not about your health. And I think people really are starting to open their eyes. And I think the Coach App is doing a great job putting focus on that. I think the movement, the sports, it makes a lot of sense. I did want to mention, you know, someone made a funny comment about, oh, like masturbate a lot or have a lot of sex. But it's true. Like your body's supposed to be sexually active. So that's right, Justin, that you need to be sexually active for things to work. Or maybe I'm wrong.
Definitely. No, definitely. Like, there was that movie, 40-year-old version, where the guy he kind of makes a joke where it's like, if is it true if you don't use it, you lose it. You know, it's kind of a joke, but in some ways it's true. It's true, right? Like you gotta keep the blood flowing in that area in general. Getting good blood flow to the penis, to the testicles is just good for sexual health, for testosterone management, for all of that. All of that. It's very important.
Yeah, and just, you know, I bring it up because I think, you know, it was a joke, but you want to be sex positive. And I think being sex positive and understanding that that's just an intricate part of your body, it also contributes to the mental health part of it. Because if you're anxious about sex or you're, I don't know, you have a bad relationship with it, it'll cause you to be anxious and cause your stress levels to go up. I mean, this is a way that you can control your body. And I think it's so important for people to put all those pieces together and never just focus on, look, there's a role for testosterone replacement, but all of these factors have to be considered before you jump to
Yes.
replacement.
Can I say one thing about the stress? So one thing that definitely we know is the same precursor that isn't. So cortisol is a stress hormone. So the same precursor that goes to cortisol, it also goes to testosterone. So we know what guys are stressed out, chronically stressed out, anxiety, you know, poor sleep. Most of that precursor is going to cortisol rather than going to testosterone. So there's ways in which if you're able to meditate, calm the mind, exercise, which is good for stress relief, sleep well, all of these things that essentially decrease your stress response, less of that precursor is being shunted or going to cortisol, rather it's going to testosterone. So even simple stress relieving exercises or whatever it is that you do that decreases your stress level can help naturally boost your testosterone levels.
Absolutely. And really, I mean, if you just think about the conversation, what we're talking about is an entire hormone system that is out of whack. So yeah, we started the podcast or the talk talking about like the testosterone pandemic, but it's really a pandemic of hormone dysregulation, right? It's your stress hormone cortisol, it's your eating hormone, the things that drive your blood sugar like insulin and a variety of others. It's
Right.
vitamin D, which is actually a hormone. People think, you know, it's mislabeled as a vitamin. Vitamin D is a hormone that drives everything from changes in your, you know, gene transcription to bone health to mood changes. I mean, it is a hormone. I'm obsessed with vitamin D. And so I wanted to kind of circle back to it just because, you know, all of these things, all of these problems of the modern day world, the modern epidemic of obesity, depression, diabetes, you know, just people falling apart as they turn 40 and 50 and 60. A lot of that is just driven by a drastic imbalance of all of these hormones. So, you know, when we talk about all of these different lifestyle changes, each of them is not just targeting testosterone. They're also like when you sleep, it drops your cortisol level. When you eat clean and not processed foods, it's going to drop your insulin levels to an acceptable level, which will then create a more stable insulin glucagon balance, which is so important to maintain muscle mass. It's such a really interesting and fun dynamic interplay of all these hormones. And I just want people to realize that in the end of the day, you don't need to understand everything that we were talking about. You don't need to understand how every one of these hormones interacts. You just need to realize that you can't not sleep. You can't eat junk. You can't not move your body and expect to feel great. And I think that, you know, at least my goal for my patients is for them to feel great, not just okay. You know what I mean?
Yeah, that's great. And look, to be honest with you, the fact that you're preaching lifestyle changes is great to me. Honestly, it's wonderful because I think it's very easy for doctors to just be like, hey, listen, just take this and you're going to feel good. But then you become reliant on it rather than, listen, take control, take charge of your life. You're invested in your own health. And doing so becomes a little bit more permanent rather than letting it, you know, just taking testosterone and, you know, becoming reliant on that. But when you're active, proactive about doing it yourself, it leads to good long-term and sometimes permanent change.
Absolutely. So let's get into that because I think that's something that so many people are interested in. Is TRT, so TRT, testosterone replacement therapy, can you just maybe, I guess, tell me like what that is and then maybe some of the reasons why you should and maybe some of the reasons why you shouldn't get it? I have my own perspective, but I'm curious as, you know, a specialist in this space, kind of what your approach is with TRT.
Yeah, so testosterone replacement therapy is great. It's essentially synthetic testosterone, and there's so many ways in which you can administer it. Each year or each couple of years, we're coming out with new ways in which to do it. So really, there's things, there's daily creams, gels, nasal sprays that you do daily. There's weekly injections that you can do. And there's every, you know, a couple times a year, you can get pellets or oils underneath your skin that over the course of months slowly dissolve. So there's always ways in which we could address your low testosterone if you are have low testosterone through TRT or testosterone replacement therapy. But one thing that no one really, I mean, I think it's a lot of patients don't know this, but if you go on testosterone replacement therapy, synthetic testosterone, you lose your body's ability to produce sperm, right? You stop producing not just testosterone, but you also stop producing sperm. So I can't tell you how many patients come in every week. They're young guys, 30, 35, 40, who are like, all right, well, I'm trying to have a kid now and I'm firing blanks. And you ask them, are you on testosterone? They're like, yeah, I've been on it for a few years. Like, well, that's why, because you're getting testosterone shutting down your testicles' ability to do the two things it does, testosterone and sperm. So I can't tell you how. I mean, I wish there's a PSA out there. We could put it on ESPN, just saying this, because I mean, it drives a lot of business to my practice, but at the same time, it's sad because it takes months for guys to recover from this, and they feel poor during that time. They feel like shit because they're not producing or their testosterone levels are low. In order to convert from that synthetic version to their body naturally produces that testosterone, it takes months. So anyway, as part of that panel that I was talking about, looking at LH. So if a young guy comes in, most young guys, upwards of 98, 99% of young guys who have low T, it's because their pituitary gland is not producing enough of the stimulus, right? So when that's happening, that's essentially what we've been talking about this entire time: lifestyle, poor nutrition, poor sleep, poor exercise, lack of vitamin D hormone, all of that. So there's ways. There's a great supplement, there's a great medication, there's ways in which we could naturally boost your testosterone levels, preserving your fertility and making you feel good without compromising your testicles' ability to produce sperm and testosterone. So
Tell us. Tell us.
well, I mean, there's a medication. I mean, there's two ways in which you could do it. You could do HCG as well as clomiphene, which is a fertility drug that we use. You know, we use it off label for guys, but it works wonderful. It works wonderful. And it's changed lives, or at least it's optimized guys' quality of life. Young, you know, guys in their early 30s up until their mid 40s. So if anybody comes in, they have a low LH, their LH number is low, I won't put them on TRT. I'd rather put them on a medication that can naturally boost your testosterone levels. At some point, your testicles may not be able to produce testosterone just because of, you know, natural aging, like the heart, the lungs, the kidneys. It doesn't work the way it used to. That's when you could potentially go on testosterone replacement therapy. But if you're young, let's preserve your body's ability to produce testosterone. And in doing so, the beauty of doing this is, again, coming back to you, is you get their testosterone levels up and you positively reinforce. They're going to start exercising more. They're going to sleep better. They're going to be motivated to eat better. All of these things. Then you could come off the Clomid, right? You discontinue the Clomid and they're back to, they're back to their normal baseline of where they should have been.
I love it. How, and this is just actually my curiosity, is the clomiphene, is that like a single dose? Is that pulse dose? Is that a daily thing? How does that work?
Pulse, you take it a couple times a week.
And is that if that drives the LAH up and then you start seeing the test normalize, do you come off of it at some point, or is that also sort of something you're on for a while?
No, no, no. So, we come off of it. We come off of it. And it's a little bit, there's more intricacies to it. Obviously, you have to keep assessing their blood levels and seeing how they're responding. But at some point, I mean, look, my goal is always to come off of it because it's
Yeah.
never, I never tell guys, listen, hey, you're going to be on this and you're good to go the rest of your life. Listen, if you're going to do this, you got to make lifestyle changes with this so you don't become reliant on this. And most guys are, very agreeable, and most guys are motivated. Look, I just need a boost. Once I get, the momentum going, I'll take over the rest and I could come off the medication.
Yeah. And so it's important to note, like, different age groups, different comorbidities. So if you're with like a diabetic, you're dealing with someone who's had, chemotherapy, or someone who's been on, many drugs for a long time, there's different approaches to deal with this thing. I think the one overarching message, though, is you got to do the lifestyle stuff. If you're taking the drug, if you're using a supplement, or if you're trying to do it naturally, it's a combination of all these lifestyle things that you have to employ to be successful. There's no way of getting around. There's no magic bullet, as they say, to give you vitality.
Exactly. I think we're all in this, this day and age where we want everything is immediate or instant. But when it comes to this, biology is biology. We can't hack it. We can hack it to a certain extent, but it is what it is, and we have to you have to put work into it.
I love it. So look, I kind of want to wrap it up with an action plan. Like, what can people start doing? I mean, I think we've mentioned it, but I want to reemphasize it. Like, what can people start doing today? If you're worried you have low T, I don't think you need to run to the doctor and get a blood panel. I don't think that's the first step. The first step is start doing things that are within your control. So, for me, the first thing that I tell anyone who's really struggling is, are you sleeping well? And you started the talk with the sleep, and I think we're like-minded on this. It is just so important to sleep well. Just make it like maybe not a job, that's not the right word, but make it your priority. Make having a really lovely sleeping environment. Get rid of the TV from your bedroom. Don't take your phone to the bed and stare at it while you're trying to fall asleep. Create a really mellow vibe if you can, but like really try to put a focus on sleep. What would be your next thing?
Sleep is the big one. We do know that there's some supplements are involved are helpful for boosting testosterone levels. So zinc, magnesium, and vitamin D. It's not to say to take all those, but that's something to be mindful of, and not to take the supplements, but the nutrition that's associated with that. So eating low carb diets, leafy greens have a lot of magnesium in it. Vitamin D, getting 20 minutes of sunlight every day is wonderful for your vitamin D levels. Exercise, and it's not just regular exercise. This is the thing. There's a couple proven ways that could naturally boost your testosterone levels through exercise, and it's the simple way of saying it is just do compound muscle exercises. So if you're doing it's heavy lifting. So it's if you're doing bench press, squats, deadlifts, push-ups, or pull-ups, basically working out your chest, your back, and your legs. These are the big muscle groups with heavy weights that boosts your levels. We do know that high-intensity interval training is excellent for your testosterone levels. A lot of cardio is actually bad for your testosterone levels. So marathon runners, triathletes, these guys have been doing this for decades who aren't supplementing it with heavy weightlifting. Their levels, their testosterone levels are lower. So exercise is another one, and then mental health. So stress levels. If there is anything you could do to reduce your stress levels, that's very, very important. So and again, it's all part of the same thing. Exercising, meditating could definitely help. But yeah, those are the things that could really naturally boost your levels.
You nailed it. And I mean it, and it's focus on it every day. No one's perfect. You can't do everything perfectly. But if you kind of focus on those things, and I always say it's sleep, food, stress management, sun, and sleep, food, stress management, sun, and movement.
Movement
Are my 5. If you're not putting an emphasis on those 5 things every single day, that's where you're going wrong. And I just repeat that over and over with patients. And over time, they start identifying what they're missing throughout the day. And that's usually really helpful. And obviously we could talk and go into detail on all of this stuff, but I think we've really nailed it. Is there anything else you want to mention, Justin?
That's it from my end. That's it from my end. But there's ways in which we can do it. People, like you said, be patient. There's ways which you can actually do it. The Coach app could definitely help with all of these.
That's the last message. The Coach app is awesome. I'm so proud to be a part of it. Their message is great. They have different tracks to based on your goals of, how you can do better with your day-to-day lifestyle management. There's a nutrition track. There's a hormone management track. It's really a great program. So check it out. We're going to do this again. Thank you so much, Justin, for your time. And yeah, have a great day.
You too. Really appreciate it. Take care.